Hello, my name is Neha Sagathe and today's our topic is need of family planning. First of all, what is family planning? Family planning is a practice of controlling births and intervals between birth with the methods of family planning. So now what is the need of family planning? So there are some needs of family planning. First of all, avoiding the unwanted birth. When there will be men or female, both are not wanted to have child, it will be unwanted pregnancy, and also it will be burden to child when they are not want to have child and there will be child. The next is bring about wanted birth. When the men and female both wanted a child but they are not conceived the child, it will be there are some methods which helps them to have nice family planning. And the next is to regulate the spacing between two pregnancies. There should be 18 months gap should be between the two pregnancies because of the mother's health and also for the development of first child. And the next is to control time of birth relation to age of parents. When the female is not having appropriate age or male is not having appropriate age, there should not be family planning or pregnancy. So the next is to determine the number of child in the family. When there will be more number of children in the family, parents will not give particular attention to every child, which will lead to poor development of child. So now the next is control the population. As we know, few years ago our country India has second on the population chart, but now it has increase and become the first in the population chart. So based on that we have to think about the controlling the population. So as we know, there are many needs of family planning. Now the how to control the family planning and how to arrange the family planning, there are some methods of family planning. First of all, it is contraceptive pills which can be given after the intercourse and before the intercourse to prevent the birth. The next is intrauterine devices. For the female, we can use copper T as intrauterine devices to control the birth or unwanted or unwanted child. Also there are condoms for female and male both. And the next there are some methods like surgical methods. In surgical methods, there are two types. For females there are tubectomy and for males there are vasectomy. And there are other methods like calendar methods. Calendar method is based on menstrual cycle of female on the ovulation period. And also there are many more methods like monthly injectables, and also there are many methods which will be used. But these all methods can be used after the proper guidance of the medical professionals.